transfer could be an option as well. You are obviously transferring the patient from your care to the hospital's care, but probably in this situation, as we'll come on to discuss, it is classically a referral letter, so that is the correct option to have chosen. All right, so I'm going to show the sample answer for the task on my screen in the next second or so, but if you'd like your own copy of the task, I'm also going to upload it now as a handout. So you can click this as it's popping up in the handout and download it so that you have a copy to look at right now or to use for your own reference after this session is finished. But I'm also going to show it on my screen. So here it is coming up now for you to see on the screen in front of you. Hopefully that's working. Anyway, let me just double check. That is what you can see. Yep. And sorry, just a little hitch here. Oops, let's go back. There we go. Now I can see that it's showing on your screen. So first of all, let's look at the layout of the letter. So the reader's job is to the reader's job title and address are first on the left, followed by today's date. But remember, it's fine to put the date first and then the address. So if you've done it in the opposite order, this is also accepted. Then we have the greeting, which is Dear Doctor. But if you have written the reader's exact job title, for example, Dear Consultant on Duty or Dear Consultant, these would also be equally acceptable. At the end of the letter, we have Yours faithfully, and then the job title of the writer, which is Nurse. And under the greeting, we have the RE line, which includes the patient's full name and date of birth. The two pieces of information have, in this example, been split onto 2 lines, which is fine, as is also writing them both on the same line. So that just leaves us with the body of the letter, the paragraphs, which here in this example have been split into 5 paragraphs. And I wonder if this is the number that you had. If you have had slightly less or slightly more paragraphs, it's not necessarily a problem. And we're going to come back a little bit later on in the session about what to do if your letter is different to the sample answer. But for now, what we're looking at with the layout, this is what you should have on your page in terms of layout. As I've just mentioned, it could be in slightly different order. The address and the date could be the opposite way around, for example. But this information in this location should be what you have to lay out your letter correctly. So now let's move on to look at the structure of the letter. So we want to check whether the reader can get a clear picture from the way the letter has been organized. And to do this, I'm just going to focus on the first phrase in each paragraph. And you can see I've highlighted them here for you on the screen. So these phrases that I've highlighted, the very first phrase in each paragraph, this should give me enough information to understand what each paragraph is going to contain and whether the writer is using a chronological or a thematic approach. So you can see with paragraph 1, thank you for seeing Ms. Stiles. Paragraph 2, today. Paragraph 3, Ms. Stiles became unwell on the 23rd of August. Paragraph 4, Ms. Stiles has hypertension. And paragraph 5, I suspect a relapse of pericarditis. So those phrases tell me the writer has gone for a chronological approach. So after explaining and introducing the reason for writing, they focused on today because this is a letter to the emergency department. Then they've provided the history to the situation and the medical history of the patient. And finally, they've provided the next steps. So while the whole paragraph needs to be clear, making the topic of each paragraph clear from the opening phrase is a good way to make sure you can score well in organisation and layout. The key details are at the front of the paragraph, clearly explaining what the rest of the paragraph is going to contain, and are not getting hidden by less important information. Let's now look at each paragraph by turn and see what contents the writer has included. So in paragraph 1, we have the patient's age, their marital status, and a request to the reader for an investigation. In paragraph 2, we have the patient's current symptoms and vital sign readings. In paragraph 3, we have details of the patient's previous admission to hospital, the means and diagnosis of her condition at that time, as well as management and discharge arrangements. In paragraph 4, we have the patient's medical conditions and medications. And finally, in paragraph 5, we have the specific request to the reader. So that's what our sample letter contains, but let's compare these details with the case notes. So here on the screen are the case notes that you've been provided with. They are attached as a handout if you haven't already seen this task, but I'm also going to refer to them on the screen. So when you're looking at a set of case notes and then being able to decide whether you've included everything that you need to in your letter, the first thing that you should check is the writing task and what we're being asked to do. So we know from this set of case notes, we're being asked to write a letter of referral and specifically to outline the case and to request urgent assessment and management for pericarditis. There are a couple of other things that we want to check in the case notes. So the second piece is in the notes section. What is your role in this patient's care? And we can see from this highlighted section that you are a nurse who has conducted a home visit as part of the follow-up care after the patient's hospital discharge. And the third place that I'd recommend that you look to make sure you include all the information that's needed in your sample answer is the section just above the writing task at the end of the case notes. And here we can find quite a lot of useful information which tell us what we need to include in our letter to score a good mark. So we can see that the nurse has organised an urgent hospital transfer, and that as part of the letter to the emergency department, she should include medications, patient history, and test results or observations. So those 3 bullet points really act as an explanation of what needs to be included in our sample answer. And we can see that all of those things have been covered in our sample answer. So the writing task is covered by paragraphs 1 and 5, the reason for writing and the next steps. The test results are covered in paragraph 2. Patient history is covered in paragraph 3, and finally medications are covered in paragraph 4. So this sets us up to feel pretty confident that our sample answer is including all of the information required as part of this task. Here you can see I have highlighted the information which has been included in the letter. So there's a lot of information highlighted, a lot of information which has been included as part of the sample answer. But let's look at what hasn't been highlighted to make sure the letter hasn't missed out anything important. And remember, what's considered important is details about the patient's care that the reader will need to be able to continue that treatment and care for them. So the blank parts of the case notes are what have been omitted from this sample test. And these include the patient's address, because there's no requirement for you to include the patient's address in your letter for OET writing. Some details about the patient's medical history have also been omitted. For example, the exact type of treatment and how long that treatment has been going on. For example, the regular monitoring, what kind of treatment and when it was commenced have been omitted. But the highlighted points do include the relevant detail as per the action plan that we have just looked at. Details about the patient's family history and lifestyle have been omitted because they are not relevant to the current condition. And then on the second page of case notes, we can see that some details from the treatment record have been left out as they are now non-critical details. For example, her vital signs on admission, her niece agreeing to stay for 3 nights, etc. Lots of the detail has been included though to make sure that the action points are covered. So from this analysis, we can see that the things that have been omitted are correct to have been omitted. They're not relevant to the reader for the current situation, and the highlighted parts cover the task fully, as we saw on the previous page. So let's now think about the language and vocabulary that the writer has used. So going back to our sample letter, let's look at the language that has been used in this letter. We have a mixture of complex, compound, and simple sentences. And this is to be expected when naturally communicating in English. And you can see on the screen now an example of each type of sentence. There are more examples of these type of sentence within the letter. I'm just highlighting one of each so that you can see this, and if you're not really familiar on what the different types of sentence look like, so that you have an example. But when we are communicating naturally in English, we will need to use a variety. It's not a case of using one more than the other, but to communicate clearly, we will need a variety of these sentences to cover all of the information clearly for the reader. There's also a mix of tenses that have been used by this writer to explain the situation, including examples of present simple, she has a low-grade fever, and past simple, throat swab investigations confirmed viral influenza type B. Passive forms have also been used, as in this example, she was admitted to Green Valley Hospital with fever and those other symptoms. But one thing I do want to point out, which is a bit unusual but relevant for this situation, is the use of the active form at the end of the letter. There's actually 2 active sentences used at the end of this letter. So as well as the one that I've highlighted here, the second sentence in this last paragraph is also an active sentence. And this is quite unusual for nurses to use active sentences because of the team nature of their roles. But here, because this particular nurse has taken the responsibility for the transfer of the patient and made the decision to refer this patient back to the emergency department, an active sentence here is appropriate because they've essentially worked alone and have taken that responsibility. Connectors have been used, but quite minimally in this letter. Here's an example of the connector while being used when appropriate to join these 2 parts of the sentence together. We can also see some other good points about this letter, that it has used some appropriate medical terms to replace the note forms. So in place of the abbreviations RR and HR in the case notes, they've used medical terms. And there's been minimal use of brackets. So things like the vital sign reports, vital sign results have been put inside brackets for one sentence and the brand of medication in a separate sentence. So in different parts of the letter, which doesn't create an overall impact of informality, which is the risk of using many brackets in your letter. But here they've been used quite minimally and in an appropriate context for this part of the letter. Another thing I'd like you to notice is the lack of set phrases. For example, there's no use of signs and symptoms of, or in regard to her medical history, or in light of the above. Now, I don't want to give you the impression that these phrases are wrong, They can be used, but some candidates are trying to use all of these phrases that I've just mentioned in every letter that they write. And sometimes this just adds sort of wordiness to the writing. And rather than the letter being clear, as this one is for the reader, they sort of have to wade through all of this additional word to get to the important information. So I want you to see a good example of a letter which is really clear without use of those set phrases. And you'll notice that this is true for a lot of the sample answers that you find on the OET website, that set phrases are used very minimally or rarely because the writing has been personalized to the particular situation that this letter is being written for. When we think about how the sample answer has evidenced the criteria, it's really good to have a copy of the assessment descriptors in front of us. And you can see on the slide that's coming up on your screens now at the top, there's a link to where you can find these assessment descriptors. And I really recommend, strongly recommend, that you download a copy of these descriptors from the page that I've linked on this slide and keep them somewhere. I would stick them up above your desk or put them somewhere that you're able to look at every day, because these assessment descriptors are so useful to understanding exactly what the assessors are looking for in your letter, and for you to be able to critically judge whether your letters are including the evidence the assessors need to be able to give you a high score. So once you have your copy of the descriptors with you, the other piece of advice is to always aim for the highest level available rather than settling for the minimum you might need to get the score that's required for registration. If you aim high, if you aim for the top and then fall a little short, you should still end up with the result that you want, because obviously to achieve a B grade, which is what a lot of our candidates are aiming for, you don't need to be perfect. You don't even need to be perfect to get an A grade. So this level of assessment criteria is above what you would need to achieve to get a B. But aiming at this level isn't going to be a bad thing. As I've said, if you aim for this level and fall a little bit short, then of course you can still feel comfortable that you're going to get the score that you want on test day. So let's look at each of the 6 assessment criteria in turn together with the sample answer. So here's our sample answer again, and the first of the assessment criteria is purpose. And purpose is whether the letter is immediately explaining to the reader why the letter is written and whether it's been sufficiently expanded during the letter as a whole. So we can see that our first paragraph of the sample answer includes a clear reason for writing to highlight, they're highlighting the phrase an investigation of a possible relapse of pericarditis. This is explained over the course of the next 2 paragraphs, how we've come to this situation today, and it's revisited in the final paragraph. So this sample answer has covered the purpose criteria very well. Coming up next is content, and content addresses what is needed to continue care and accurately represents the history provided in the case notes. And we can see that the second paragraph provides the patient's current conditions and vital signs, and that these have been copied correctly. And similarly, her medical conditions and medication are included and correctly copied. So this is an accurate summary of the patient's history so that the reader can continue caring for the patient. And in the middle paragraph as well, the content there gives the reader enough background to understand what happened previously when the patient was first admitted and why that is still relevant now with this reason for writing today. Conciseness and clarity is the next criteria. And this checks whether your writing is clinical and factual and uses, conciseness and clarity is checking whether the information is summarized effectively and presented clearly. And we can see in this example that, this patient history has been summarized well in the example sentence highlighted on the screen. So the details of the patient's first admission have been summarized well in that opening sentence of paragraph 3. And as we previously discussed, details about the patient's history of depression, their family medical history and lifestyle have been correctly omitted to avoid giving the reader irrelevant detail. Genre and style is checking whether the writing is clinical or factual and has used language appropriate for the document. So as previously discussed, the letter includes technical terms which are appropriate for the reader to further summarize the case notes. The only abbreviation that is being used is IV, which is well known. In fact, is well known as the full form and so is appropriate to be used. And as we've already mentioned, brackets have been used, but are in a controlled way, so it doesn't impact the reader's understanding or the level of formality of this letter. Organization and layout is checking whether the letter is logical, clear, and the key information is highlighted. So as well as the earlier parts of this session, looking at how the paragraphs are well structured and it's clear from the initial phrase what the content of each paragraph is going to be. This sample letter also includes time phrases to assist the reader to understand the timeline of events. So we've got phrases like today, the 23rd of August, the 25th of August, and so on. And finally, language. So language is checking whether the sample answer is accurate in terms of spelling, grammar, punctuation, vocabulary, and sentence structure. As would be expected from an official sample answer, the language features are all completely accurate. And additionally, language has been used flexibly through the different sentence types and tense that we looked at earlier on to clearly communicate the information to the reader. So I'm going to ask another poll question to you now. And this one is asking, how similar is your letter to the sample answer that I've been sharing with you on the screen? So there's 3 options for you to choose from: almost the same, quite similar, or quite different. Just give you a few seconds to choose your answer option from those 3. Okay, so the majority of you are saying that your answer is quite similar. Your letter is quite similar to this one. There's a proportion of you, around a third, saying that actually my letter is quite different, and then some that are saying it's almost the same. So this is to be expected. What I would say is sample answers that are provided by OET are just one way to write the letter for the case notes. So those of you who've answered that your letter was quite similar or quite different could still have written a good letter, provided you've still evidenced all of the assessment criteria equally well. So my recommendation is to make sure that your letter evidences the assessment criteria as well as the sample answer. So if yours is different, but you can evidence using the assessment descriptors that it's as good a level as the sample answer, then you've got nothing to worry about. Your answer option would also be very well received by the assessors. However, if you have missed out information or included information that isn't in this sample, then you might lose marks for content or conciseness and clarity. So you do need to perhaps compare your letter with the sample answer and make sure that for those parts of the assessment criteria, yours is equal to the sample answer. Similarly, if the accuracy of your language and sentence construction is not so good, then you will lose scores for language. As I've said with the assessment descriptors though, you don't need to be perfect. So it's not about you needing everything to be absolutely correct. If you look at the assessment descriptors, you can see that the language used to describe perhaps a 5 out of the 7 is saying that mostly or overall these are still good things. And so aiming higher than that, but recognizing that you don't need to be perfect, that you can make some mistakes and still end up with a B grade overall or a C+ grade for nurses applying to the UK, should reassure you that your writing is still of a good standard. And of course, these are all things that you can work on. What I'd also say is this letter isn't necessarily perfect. Improvements are always possible, even to sample answers that have been provided by OET. So I would, for example, omit the patient's previous occupation in the first paragraph. While this is quite a standard inclusion for healthcare professionals when referring a patient to another healthcare professional, for me in this task, because it's an emergency situation, the fact that this patient is a retired school teacher isn't particularly relevant and so could be omitted, and this would still be an excellent letter. I'd also suggest some perhaps clearer punctuation could be used to make the list of medication easier for the reader to understand and process. So thank you to everyone who submitted a letter ahead of this session. When I checked a little bit earlier to select those that I'm going to spend a few minutes talking about at the end of this session, we had around 250 letters submitted just from nurses. So that's a great response. And unfortunately, I can't cover anywhere near that many letters in this session today. I also can't provide very detailed feedback. I'm just going to make a few comments to illustrate some different ways of focusing on the assessment criteria and the case notes in the letter, to give you an example of how different letters may work or not really meet the assessment criteria. There is a lot of benefit though to getting feedback on your writing, and not just to find out how you might score against the assessment criteria, but also how you can improve on your writing. And so my recommendation would be, if you have submitted a letter to us, that it would also be a good idea to submit your letter for feedback to one of our premium preparation providers, many of whom are part of our All Stars program at the moment. So if you visit the link that's currently here on the page, you can find a list of premium providers. Many of them offer writing correction. So we would recommend that this is a good use of your time, and it's also good value for money to find out exactly how you score against the assessment criteria and what you need to do to improve on your weaknesses. After this session, what I would recommend that you do, for those of you who have already written your letter, review your letter and notice the similarities and differences between it and the sample answer that we have now provided, and think about whether anything is less clear in your letter, which you could improve. Also check your language and spelling to make sure it's accurate, and take some time to make some corrections. It doesn't have to be exactly the same as this one, as I'm going to show you in the next few minutes some examples from different candidates who have uploaded their answers. There are more than one way to write something, to phrase something, so don't feel like you need to rewrite it exactly to match the official sample answer, but you should notice that there are some corrections that you need to make, maybe some information you need to add or omit. So make those corrections and then rewrite your letter in perfect English. So when you come back to review and revise from it, you now have your own good example. So I've got 9 responses that were submitted by different candidates. I'm not going to embarrass them by giving out their full name, but in the next few slides, so you can notice whether your letter was one of those that I've picked out, I'll put your name and just discuss for a few seconds some feedback for your letter, which can be useful to all candidates who are trying to understand how to apply the assessment criteria. So the first one, let's go to the next slide. The first one was submitted by Anita, sorry, not sure quite how to pronounce your name. And the comments that I would make about your letter are the dates that you've used give a good timeline of events. So you've used the admission and discharge dates, as well as the date that the home nurse was arranged to visit. But the structure of your letter could be clearer. So, for example, you've included some less relevant information. For example, the dog walking is unnecessary to this situation and to this reader. And you've put the less relevant information, the details of her chronic condition, above the information that the reader would be more interested in, which is obviously what is happening right now. So in terms of how you've structured this letter, I would suggest having a look at the structure for the sample answer and noticing how the sample answer after the reason for writing starts with today. This is what's happening now, and this is what the emergency doctor would want to be knowing straight away to understand how they're going to continue care for the patient. The next letter that I'm going to talk about is from Manpreet. This letter has been structured well. It's written in order of importance to the reader, and there is a clear purpose at the beginning. But some actual dates would have been helpful here. So although time phrases have been used today and last week, it's not clear from last week whether that was just a couple of days ago or longer ago in the past, because obviously without knowing what the date is actually today, we then have to calculate when in last week, and last week might have been 2 days ago, or it might have been more days ago. So actually using the dates of admission or discharge would have made things clearer. There's also a few inaccuracies in this letter with content and language which could be improved. So for example, today is the first home visit, whereas the letter suggests that regular home visits. Following her discharge, she was provided with regular home visits, which is a little bit confusing. So be careful with little inaccuracies like that, and also language, use of articles, etc., which would improve the overall accuracy of this letter. The third letter that I can comment on is from Marina, and this letter includes good purpose, and the level of urgency is really clear from the start. Time phrases and dates have been used to provide a clear timeline, and all of the medical history and medications have been copied accurately, so the reader would be informed of those parts of this patient's history. A few unnecessary details have been included about the patient's first admission. So all of the different ways that the patient was managed and advised with self-care monitoring and so forth, those could have been omitted. And there are, again, some language inaccuracies with examples of articles and tenses and so forth. This letter was submitted by Sinu. It's a handwritten letter, which is fine. I was happy to receive letters both typed and handwritten. Obviously, at the moment, when you do the actual test, your letter will need to be handwritten. Generally, this letter had accurate selection of case notes to include or omit. One thing that I did find with this letter, which is good for you to consider with your own handwriting, this handwriting isn't messy at all, but it did require quite a level of concentration to read. Because the letters are so close together, I have to read quite slowly and carefully to be able to understand the handwriting. So it wouldn't be penalised. There's no penalty for handwriting, but this is just a reminder to make sure your handwriting is as clear as possible to the reader. The long second paragraph would also have been easier to follow if it had been broken down into the first admission and discharge. So it was a long paragraph to read, and because of the concentration I needed to apply with the handwriting, it took me quite a while to read through it. So do bear that in mind when you come to write your own letters. This letter from Nimi again has a clear purpose, and this is expanded with details from the case notes during the letter. But some details have been omitted which were part of the task. So for example, the medications that the patient takes and their current test results have been omitted, which were part of the task, one of those action points that were supposed to be included in the letter. And so that would have an impact on the score for content with this letter. This letter was provided by Jisha. This is another example of a well-structured letter, and most details that are needed to continue care are included, apart from the dosages of medication which are missing. There are some unnecessary details and phrases. So for example, please note, and she was on regular counselling, all the relevant documents have been included, etc. So just be careful of, as I was saying a little bit earlier, not giving too many words to the reader to sort of wade their way through to understand the situation, and only include things that are needed to continue care for the patient. So the regular counselling, which has been included in paragraph 4 here, are not relevant to this current condition and don't need to be included. This letter is from Aaron, and he also has a clear purpose, and the structure of this letter is easy to follow. But this is another example where the writing is quite wordy and could be more succinct to get a better score with conciseness and clarity by removing some unnecessary language. It's essentially just to reduce the number of words to say the same thing. So, for example, verbalized being unhappy and expressed frustration. Verbalized and expressed are two words meaning the same thing. The patient spoke out loud or mentioned or reported, and so that could have been reduced to a shorter phrase and the same information communicated. She was diagnosed with the above mentioned condition. This could also be shortened. She was diagnosed, or these results led to the diagnosis. It's an easier sentence for the patient to read and doesn't include all of this extra words that takes time away from the main point of the task. This letter is from Jana. This is a concise letter and it has clear purpose and structure. Time phrases have been used well and the details have been copied accurately. So overall, it's a good letter, but paragraph 4 could do with some editing to remove the details about the patient's depression and lifestyle, which aren't relevant to the current urgent situation. So whereas the other paragraphs are well summarized, paragraph 4 sort of lets it down a little bit by including some of this unnecessary information. And the final letter that I'm going to mention comes from Juliet. This letter contains the relevant case notes and has generally omitted the details which aren't required. But like some of the earlier examples that we saw, specific dates of admission and or discharge would have been helpful for the reader to understand the timeline of this letter, and structuring the letter in order of importance to the reader would have made this much more straightforward to read. So those are just 9 different examples of letters submitted by some of you joining the session tonight. And you can see that a lot of the comments that I've been focusing on revolve around your selection of the information to include, structuring it so that it's clear and in the order that the reader would want it, and making sure that you've included all of the details as per the writing task, and that you have included, omitted the details that aren't required. Other things like language, I didn't focus on so much. There are some inaccuracies that came across in these different letters, but I think a lot of candidates tend to focus a lot on language and not enough about these other assessment descriptors: organization and layout, content, conciseness and clarity. These are three really important criteria that you should be focusing on. Once you've got the other ones sorted in your mind, for example, purpose, genre and style, language, once you know what you're doing with those criteria, these other four assessment criteria are really important to focus on and make sure that you're doing well and can score as high a mark as possible. Just going to scroll back to my opening slide because that's all that I wanted to discuss with you tonight. But it does leave me with 15 minutes to answer any questions that you perhaps have and would like to ask me about this sample answer or the case notes for this particular task. So if you look at your control panel for the session, you should see one of the options is questions, and you can click on the drop-down arrow for that part of the control panel and write your question in the box there if you have one that you'd like me to answer in the last 15 minutes of this session. I'm just going to try to expand this box so I can see the questions a bit more clearly. That's a bit better. And I'll just have a look at some of the questions and see if I can help you with some of the questions that you've written. So Ramona was saying, is writing "Dear Sir" or "Madam" okay for this? It wouldn't be penalised to write "Dear Sir" or "Madam," but with the healthcare profession, it's often a more professional approach to use their job title. So here, "Dear Doctor," or as I mentioned at the start, "Dear Consultant on duty." That's a much more professional approach than using "Dear Sir" or "Madam." Chum asked a question fairly early on in the session, and I hope I've answered that question during the session for you as to why the current situation should appear after the reason for writing in this letter. Because it's an urgent situation, the reader would want to know what has most recently happened as a priority, and that's why this letter has been organised in this order. I'm going to actually scroll down to some questions that are just coming through now, because I think otherwise I'm going to be repeating myself with things that I've already answered. So Princey is saying, how can I send letters for correction? So Princey, we will be making a recording of this slide, this slideshow through our Facebook page. And in one of those last slides that I shared before I looked at some of the responses submitted by candidates, there was a link there to our premium preparation providers, many of whom offer writing correction that we recommend. And you're welcome to contact one of them and submit a letter for them to provide you with some feedback. Raquel says, if there is date of birth and age in the case notes, which one would I write? So in the RE line, we encourage you to write the date of birth because this is standard and most helpful to the reader of the letter. It's something that they can check in their database against their system, for example. And so date of birth in the RE line, you can include the patient's age as well if you wish in the introduction. Jancy says during today's home visit, or today during a home visit, which would be more accurate. So because, as you saw in this sample answer, we're starting the paragraph by using the time phrase, today is really helpful for the reader to understand the timeline of what's going on, but also, as I explained, using that phrase right at the beginning of the paragraph tells me that the contents of this paragraph are all going to be about today's visit. So although the other phrase isn't wrong, today is a much clearer way of starting a paragraph, and that's why we've used it in this sample answer. Precious says, for emergency case notes, is it compulsory to start with the most recent visit? So how we try to explain it for you is, for any letter, you should be considering the reader's needs, putting yourself in the reader's shoes as it is, and thinking about which information would I want as the reader as a priority. Now, in non-emergency situations, that can be done in a different number of ways, but when the situation is urgent, it is an emergency, obviously then the reader is going to want to know as a priority what has just happened. Why is this patient being referred as an emergency? And that's why this letter is structured with the emergency at the beginning. This is an emergency letter, and then next is what has just happened to provide that information to the reader. Jattini says, do I need to add the address in case of requesting a home visit? And can we write I, ours, us, we, etc.? So this was something that I mentioned during the session. There's no requirement in OET writing, even if you are requesting a home visit, to include the patient's address. Now, of course, this isn't a home visit. You are at the patient's home and you're referring the patient to the hospital. But if it was the other way around, there's still no requirement for you to include the patient's address in your letter. As you'll also have seen from this session, you can use active forms such as I, we, etc. And I've given some examples of how and why they have been used like this in this letter. Rachel says, can I confirm if this sample test is considered urgent? And yes, I can confirm this is urgent because we're writing to an emergency doctor and we're requesting an urgent assessment of this patient's condition as per the writing task. And that's why what has just happened comes immediately after that reason for writing in this sample answer. Irene says, is it needed to mention all the medication she's been taking, or we can make it as an attachment? So our advice with medication is always to look at the case notes and the writing task to make a decision about how much detail about the medication needs to be included. Now, in this set of case notes, you can see that there are a number of action points provided at the end of the case notes of things that the reader needs to have included in the letter. So there were 3 things: the medication, the test results, and the patient's current condition. And so because of that, it is important that you include the details of this patient's medication because it has been requested as part of the writing task. Marielle says, I'd like to ask if handwriting matters. So your handwriting is not specifically assessed. It's not part of any of the assessment criteria. However, do bear in mind the assessor and make it as easy as possible for them to read your writing. There was an example that I shared with you as one of the 9 letters that I picked up on that wasn't messy, but because of the closeness of the letters together, it was quite, it did take quite a bit of effort for me to read the letter, and so perhaps relaxing some of that tightness would have made it a bit easier for me to read the letter, which is helpful obviously to the assessor. Kochurani says, if it's a known case, can we write as you know? So this example, you're writing to someone who doesn't know the patient, so it wouldn't be appropriate in this situation to use that phrase. Rizan said, can you send a recording of the session? And yes, we will be making this available via the OET Facebook page once this session has finished. So do look out for the video a little bit later or even tomorrow, and you'll find a copy of this recording on the video, on our Facebook page, sorry. Let's have a look for a few more questions. Is it okay if I start with Mr. X requires urgent assessment, or I'm writing this letter to refer? So you could use I'm writing this letter to urgently refer, or Mr. X requires urgent assessment. But what we would say is do make it clear right from the beginning, if this is an urgent situation, make it clear by your choice of language that it's urgent, so that the reader is very clear by the end of the first sentence, the first paragraph, that they have an urgent situation on their hands. Robert says, which one is better to use, yours faithfully or yours sincerely? So with the person you're writing to, if you don't know their name, so as in this example, you're writing Dear Doctor, the correct ending for that greeting is yours faithfully. And Shinoji is also asking a question about the salutation. Should a comma be used after the salutation? Essentially, this is a choice of yours. It is acceptable to include the comma or omit the comma. So based on your personal preference, both are accepted. Hemant says, if we include just a very few irrelevant information like depression and counselling, but the rest is good, what would be the score? So this focuses on conciseness and clarity, one of the 6 assessment criteria. So if you have included some irrelevant information, as I picked out in some of those answers that were submitted by candidates, your score for that individual criteria would be impacted. And potentially, if you made mistakes in language in those sentences as well, it would also impact your score for language. But primarily, it would impact your score for conciseness and clarity. I can't tell you exactly what your score would be, but bear in mind that your overall grade is decided by the combination of your scores for the 6 assessment criteria. So if everything else is excellent, you will still score a B with those minor mistakes in just one of the assessment criteria. Sorry, I'm just looking for a slightly different question that I've already answered. So what about if I'm starting with the last admission and then to the current situation? Regarding the home visit, can I use a past tense to illustrate the symptoms she reported? So sorry, that's 2 questions there. The problem with organising your letter with the first admission to hospital and then the current situation is that the reader has to go through all of that information to find the information that they really want, which is what has just happened. So it is really important to structure the letter in order of importance to the reader. And for an emergency situation, that is going to be what has most recently happened. All right, I'm just going to find one last question to answer, and then unfortunately we have reached the end of our time here. So let's have a quick look for a question I haven't answered yet. Is the order of the letter starting like purpose, current situation, background history, medical history, request for the reader? That comes from Emily. So for this letter, that is the structure, but we're not saying that every letter will follow this structure. Obviously, you need to judge each set of case notes on a case-by-case basis and decide, as I've just mentioned, which organisation would be clearest for the reader. Now, another emergency situation might also follow this type of situation, this type of structure, but it may not follow it exactly, apart from the fact that, as I've mentioned, the most recent details will come after the reason for writing. The main aim is to put yourself in the reader's shoes and decide what information they need as a priority and provide that to them as clearly as possible. It's been a really great session. I'm sorry it's come to the end. I can see that there have been a lot of questions submitted that I haven't been able to answer. And as I already said, I'm sorry that so many of you have submitted letters that also we weren't able to respond to. But please do check out the video when we make it available on our Facebook page. We'll also provide the link there for you to submit your letters to our premium providers. And we would recommend approaching them for some feedback and guidance about your writing and how you can improve on any weaknesses you have with writing. Thank you so much for joining me today. And for those of you who did submit responses that I've shared with everybody as part of this session, I'll see you all again very soon for another Q&A session. Thanks. Bye for now.